Hi viewers, welcome to our channel. Presently, we are with Dr. Karthik Panduranga and he is MBBS, MD, General Medicine, DM Cardiology. Hi sir, how are you?
Hello, Ishwar.
Sir, first of all, thank you so much for spending your valuable time with us. Sir, my first question is, what is heart attack?
So, to understand heart attack, we should know what is heart.
Okay.
As we know that heart is a muscle and it's
Okay.
a special kind of muscle. Just imagine that heart starts beating when you're inside the womb, and it will beat at almost 80 to 100 heart rate till you die without failing to stop or without even pausing. So this is a special kind of muscle which supplies the blood to whole body. So now if we have such a special muscle, we should have good blood supply to this heart. Why? Because if the heart gets good oxygen and nutrients, then it can pump very nicely. So for that, there are multiple vessels or blood vessels which will supply the heart. And if this blood vessel has any block in it, this block will give rise to a heart attack. So this heart attack can happen at any age. When I say any age, even young people, young teenagers can also end up with a heart attack. So if you say the technical definition of a heart attack, basically heart attack is defined as something where there is a sudden cessation in the sense blockage or non-availability of the blood to the heart, which will give rise to death of that part of the heart which the blood supply is not going. And this can be detected with ECG, echo and blood test, and the blood test name is troponin.
Okay. Sir, what are the symptoms of heart attack?
So when a person has a heart attack, the most common symptom which we tell is a chest pain. Now chest pain can happen in the center of the chest or in the left side of the chest, the most common thing. And this chest pain can radiate or can move towards the left hand sometimes, or it can radiate or move towards the neck also. There are some rare conditions where the chest pain may not be there. The patient can present with backache or back pain. They can sometimes present with right side chest pain also, or they can present with epigastric or little upper part of the stomach. If they get pain or burning sensation, even that can be a sign of a heart attack. Then there are some other things. Some people with diabetes or very elderly patients who are more than 70 years, they may not present with chest pain at all. They can just present with profuse sweating, even as simple as sweating, or simple things like giddiness, or patient having breathing problem. These things can be heart attack. So we have to be very careful in whom we are dealing, and any doubt we should always check with an ECG.
Okay. Sir, what is stent?
Okay, so stent is a device. I would say it's a device. If you take technical meaning, it is a scaffold, and in layman term, if I tell, it is just like a spring. So we have used all ballpoint pens and all that. We have seen how the spring is. Basically, spring is just like a metal thing, which is like a tube shaped metal thing. Okay, so what is the use of this stent? So this is made up of nickel and titanium, a special kind of alloy which is quite sturdy and which can be expanded to a desired size, and it will retain its size for a very long time, and in some cases lifetime it will retain the stent. So when do we use it? So whenever we see that heart has got blood supplies, as I said, one of these blood supplies, if it gets blocked, then what we do is we remove this block, and to make sure that it should not get blocked again, we put a stent there. These stents are special kind of stent, not only because it is made up of a special metal, but also these stents have got medicines on it, so that a new block should not happen in that particular place. So these stents are placed in our heart blood vessels by a technique or by a procedure called angioplasty.
Okay. Sir, does cholesterol leads to heart attack?
So cholesterol, or in general, it's a part of a fat. Okay, so cholesterol, when it is high in our body, usually they get deposited in blood vessels, and once they get deposited in the blood vessels, these are the ones which will cause blocks in the blood vessels. So cholesterol treatment, or if the patient is presenting with high cholesterol, such patients should compulsorily be treated with medicines which will reduce the cholesterol levels in our body.
Okay. Sir, smoking and drinking effects on heart attack.
Yes. So smoking, as we know, tobacco has got almost 2000 chemicals in them, out of which there are at least 200 to 300 chemicals which are dangerous for the heart. In
Okay.
that, the nicotine, which is the most common chemical in the tobacco, once it is smoked, it will cause the blood vessels to become smaller in size whenever we smoke, and also it will increase the speed at which blocks are formed. Okay, so these blocks, once we are born without any blocks, but as the age progresses, for any person, small blocks will happen, like 1% block, 5% block, 10% block, like that. But if we start smoking, these blocks will become very common, and not only heart, blood supply to the brain, blood supply to the hands, legs, all of them, they start getting newer blocks, and with those blocks newer problems can start. Like for example, if brain vessels they get blocked, you can get a stroke.
Okay.
Or hemiplegia, paralysis. Whereas if we get blocks in the heart, of course, as I said, heart attack can happen. And if blocks develop in the legs, vessels of the legs or hand, then you can end up with a gangrene, wherein
Okay.
you can have to cut your hand or leg also. So that's why smoking is extremely dangerous.
Okay.
Okay, so of course there are other things about smoking, that is, it can lead to cancer. That is of course another thing. But then coming to alcohol, so alcohol contains a chemical called ethanol. Ethanol, when we have ethanol in very high amounts, so first it will damage the liver. Okay, and
Okay.
liver is the main organ where it will produce proteins which are required for our immunity and also for clearing our cholesterol. So in a way, it is affecting our cholesterol levels in the body by reducing the protein levels. That is one. Two, alcohol has got direct effect on heart also. If one particular level is crossed, and if we have lot of alcohol, then that will damage the heart by increasing the size of the heart. That is one. Two, it can give rise to some conditions wherein the heart rate can go up to 200 and 300. The normal heart rate is 60 to 80.
Yeah.
But in such conditions where alcohol is, we have alcohol at a very regular intervals, and that too in a large quantity, in such patients, patients will end up with a heart rate of 200 and 300. They are known as arrhythmias.
Okay.
And these are very dangerous. Patient can suddenly die because of arrhythmias.
Okay. Sir, what are the precautions to be taken after bypass surgery?
Okay, so as I told about stenting, so if there are any blocks in the heart, okay, if there are multiple blocks and we cannot put stent everywhere, and
Yes.
putting multiple stents is also dangerous. Why? Because if we have blood vessels covered everything with the steel or whatever metal, then again another block can happen, and that is quite dangerous, because while doing procedure they can end up with a bleeding also. So in such conditions we do procedures something called as bypass. Like for example, if there is a road congestion is there, okay, so you're not able to clear the road, what will happen? You have to create one more road which bypasses that point A to point B, and you end up with a newer road but with a different way. So similarly in heart also, what happens is the natural blood vessels, if they are not flowing properly and if we are not able to put stents properly, then we use something called as graft or bypass, wherein we try to put new vessels and we attach it to the end of the artery so that blood should reach the heart. So this is known as bypass. So once bypass is done, Okay, usually it takes about 7 to 14 days in the hospital, and once they are discharged, they go back home. We usually tell them to follow 5 things. One, lifestyle changes. Okay, lifestyle changes in the sense they have to take care that they should not be sedentary in life. So they should not gain weight by being sedentary. Some level of activity has to be there. So this activity includes regular exercises, or including simple things like walking 15 minutes to 20 minutes daily, and continue to be active throughout the day. Should not sit at one place. That is one. Second thing, dietary changes. Changes in the sense we should avoid carbohydrate rich and fat rich food. For example, rice. The rice which we eat commonly in India, or especially in South India, it is white rice, which is the husk of the rice is removed. So that is not a good food actually in that way. It is quite tasty with sambar and all that, but as such, pure white rice is not good because it is very carbohydrate rich, and in turn this carbohydrate, whatever we eat, gets converted into fat because it has to be stored by the body. That is one. So reduce your rice intake. So third thing is reduce your fatty food intake, like fried items, oily food, especially bakery items have to be avoided as much as possible. Packed items have to be avoided as much as possible. So when I say avoided, you should not stop altogether, but make sure that you have as little as possible. If somebody is providing you some small amount of chips or something, okay, have one, but that's it. Stop. Don't have more, because you have a problem, you have to deal with the problem. Fourth, very important thing, medicines. Okay, once a doctor gives you a list of medicines, they should not be stopped unless the doctor says otherwise, and you have to come for the follow-up to the doctor, the same doctor who has operated on you, regularly. So once some of these medicines are blood thinners, and some of these medicines, they control cholesterol levels in our body and control the fat levels. So these are extremely important medicines. Now, as I told earlier, the blood vessels will have blocks. Okay, now once you have put a stent or once you have put a graft, we have not removed the problem, we have just bypassed the problem. Now we have created some way for the blood to flow, but that is not the permanent solution. The permanent solution lies with the patient himself, by changing his lifestyle, the way he eats and the way he does his work. Those things have to be avoided. Fifth important thing, anxiety and tension. A person should not take tension. He should come up with some ideas like yoga and some things like simple aerobics and all that. You have to create some hobbies. You have to create a circle of friends who are quite friendly, or you should have a new pet in your house which will reduce your anxiety levels. So that itself will help you in a long run to avoid a further attack or heart attack in future.
Okay, thank you, sir. And what is the diet you need to maintain, sir, like healthy lifestyle?
So as I mentioned in short, in brief, that most of the times our Indian foods are mostly vegetarian in nature, and that is quite good in a way.
Okay.
But we have lot of carbohydrates like rice.
Yes.
That should be reduced as much as possible. Whenever you want to have rice, you have a small cup of rice, cup of rice, and you should limit it to it, because usually what happens, rice, especially in South India, whenever we find that the sambar or rasam is quite tasty, we end up having a lot of rice. So that should be avoided as much as possible. And try to have wheat or ragi and cereals. Cereals should be rich, should be added to our diet. And moreover, try to have pulses. Pulses will give you that adequate amount of protein. Now, if you see among all the food items like carbohydrate, proteins and fat, proteins have to constitute at least 60% of our food. That should be the aim. That means we should have lot of pulses, and you should have dals, black grams, horse grams, everything has to be rich in our food. So that should be taken care. And as much as possible, avoid fried items.
Okay. Sir, actually, we have seen some cases like heavy exercise and heavy gym, these
Yes,
leads to heart attack. Is there any possible, sir?
okay, so there have been some conditions like there was a famous Karnataka
Yeah.
actor Punit Rajkumar, and there were some footballers who recently died, and there were young singers who suddenly died on stage. Okay, so one of the things about the athletes and people who go to gym regularly is they strain themselves by overdoing things. Okay, so training is quite good, physical activity is extremely good, and it is desirable to have physical activity, but do train your body, but don't strain. That is the
Okay.
thing. Now if you go through some American guidelines, they tell very clearly that in a single week you should, or anybody who is able to walk and run should able to do only 150 minutes of moderate exercise or 75 minutes of strenuous exercise. So what does moderate exercise means? Moderate exercise means swimming, jogging or cycling. Okay, and strenuous exercise means going to gym and getting workouts done with heavy weights. So nowadays there is a trend that people go to something called as high intensity training.
Yeah.
Now if you ask me as a cardiologist, is it desirable to have a HIT on a routine basis for everyone? I would say no, it is not desirable. But those who want to do it, I would advise them to just visit a physician or a cardiologist once before starting this training. Now high intensity training is very, very strenuous, and the majority of the times the trainers who are involved in training, they are not competent enough to decide which person should need how much intensity. So that intensity word is very important. High intensity exercises are not desirable for any person. Of course, those who are athletes and all that, they can do it under supervision of a doctor.
Okay. So daily, how much time you need to do walking?
So I will tell you one thing.
Yeah.
Regarding that previous question,
Hmm.
can gym lead to a heart attack?
Yeah.
Okay, so majority of the people who go to gym, they want instant result, so they end up doing very high intensity exercises.
You
and
put on
they-
heavy weights and
heavy
all.
weights, and they end up having lot of supplements.
Yeah. Okay.
So these nutritional supplements, which usually the fitness centers they give, or those who are available in the market, some of them are quite reliable and can be trusted, but majority of them can't be relied because they are not scientifically proven.
Okay.
And these things, when there is a high intensity exercise, that affects heart in lot of ways. So there is something called as athlete's heart,
Hmm.
where if a person begins to do high intensity training, the heart size will increase. Just
Okay.
like how our biceps increase in size, the size of the heart increases, the muscle size increases. So heart will require more blood to flow,
Okay.
and that will increase the risk of a heart going for multiple problems in future. Like for example, they might end up with simple blocks, which can, while doing high intensity exercise, that those blocks can rupture suddenly. They will get fractured, and this fracture will, even if it is a 10% block, within few minutes it can become a 100% block. So that's why we have to be very careful while going for a gym or any strenuous exercise. And our motto should be to get trained but not to get strained. That should
Okay.
be the motto.
Okay. Sir, as I asked you, like how much time you need to do walking every day?
So as I said, the guidelines say that about 150 minutes in a week
Okay.
of moderate exercise. Moderate exercise includes jogging, swimming, cycling,
Okay.
or even brisk walking
This
can be
walking
included.
also. Okay.
So 150 minutes in a week, in which 2 days you should give rest.
Okay.
5 days is ideal. About 30 minutes daily is quite ideal.
Okay. So thank you so much for your valuable time. And so you would like to say any healthy habits to our viewers?
So one is healthy habits. One, you should not sit as much as possible. Be active, walk around. That itself is a very good exercise. So I don't remember, there used to be an advertisement wherein the people used to say that take phone, listen to songs, and then walk around. That is also quite good. If you're talking with somebody for longer hours, fine, do it, but walk around. If you're able to walk around and do your stuff, that is excellent. So walk around, walk a lot. Make sure you have at least about 5,000 to 6,000 steps in a day. Nowadays, a lot of mobiles are there, they count your steps. So that is extremely useful. So be active. That is what is required. Don't strain your body, but be active.
Okay. So thank you so much for thank you so much, sir, for your valuable time. So viewers, this is all for today. Next episode we'll meet up. Thank you so much.